I'm Charles Bankhead of MedPage Today, reporting from the American Society of Clinical Oncology meeting in Chicago. Men with metastatic castration-resistant prostate cancer had dramatic improvement in bone scans when treated with an investigational multitargeted tyrosine kinase inhibitor. Analysis of best response showed that more than 90% of the men had no progression when treated with cabozantinib. Dr. Maha Hussein of the University of Michigan in Ann Arbor described the results in this interview with MedPage Today.
So this is a study that enrolled 171 patients who had progressive castration-resistant prostate cancer. All men were treated with oral cabozantinib for 12 weeks. At the end of the 12 weeks, their disease was evaluated, and what we found out that two-thirds of the patients, specifically 68% of the patients, had their tumor cease progressing by comparison to when they started on the study, where all their, where their cancer was progressing. We also noted that there were some regressions in their measurable disease, but most importantly, patients who had bone scan metastases, 3/4 of them had either partial or complete resolution in their bone scans, and a significant percentage, again, 3/4 of the patients who had pain to start with, their pain improved, and remarkably, their narcotics, for those patients who were using narcotics, their narcotic use was either decreased or discontinued.
The potential for earlier use of cabozantinib in the treatment of prostate cancer is one of several issues that will be addressed in ongoing and future studies of the drug.
There are multiple levels where a drug of this nature could actually be tested. I do think the best step right now is to better characterize its effect in people who have the spread castration-resistant cancer. The biology of it would suggest that potentially, as patients have either early progression on hormone treatment or in fact are hormone sensitive and are about to start hormone therapy, there may be a role to investigate this drug in that setting. We're actually asking some of these questions in the lab, and we're also planning certain clinical trials to try to address some of these questions.
From the American Society of Clinical Oncology meeting in Chicago, I'm Charles Bankhead, MedPage Today.